Okay, so Assalamualaikum and a very good morning to Madam Naziha and my fellow panelists. And welcome to today's panel discussion titled Ending the Trend Lifestyle Diseases in a Modern World. So this discussion is aligned with Sustainable Development Goal 3, which aims to promote good health and well-being. Today's discussion will explore the issue from multiple perspectives, including trends, causes, impact, and solution. Before we begin, I would like to introduce our panelists. So panelist 1, Farahim binti Fairuz, will discuss the current trends in lifestyle diseases supported by relevant case studies. Panelist 2, Hanim Khadija binti Hairul Nizam, will focus on the key contributing factors, particularly those associated with modern lifestyles. Panelist 3, Jasmine Camelia binti Nur Azman, will examine the health, social, and economic impacts, as well as the challenges in preventing lifestyle diseases. And our last panelist, panelist 4, Nurul Farahim binti Abdul Rahman, will share solution and preventive strategies that support SDG 3. So to provide a clearer context for our discussion, I'll begin with the overview of the topic. So lifestyle diseases are also known as non-communicable disease, include conditions such as heart disease, diabetes, and obesity. So according to Bawan and Carr 2021, these diseases are strongly associated with how individuals interact with their modern environment, where sedentary behaviors, unhealthy diets, and smoking are common. So the authors emphasize that many of those conditions are preventable, especially if healthy habits are adopted early. These highlight the importance of shifting public health strategies from treatment toward prevention, which will be the key theme throughout today's panel. So let's start with our panel discussion. I would like to invite panelist 1, Farhi binti Fairuz, to share insights on the current trends and case studies related to lifestyle diseases.
Thank you, dear moderator. Good evening to Madam Naziha and all the panelists. As the first panelist, I will briefly talk about the current trend of lifestyle diseases and share a few real-world examples to show how serious this issue has become. Okay, to start with the overall trend, lifestyle diseases such as diabetes, cardiovascular diseases or CVDs, and obesity are increasing very rapidly worldwide. According to a recent review article by Dr. Ramkumar, more than 500 million people globally are currently living with diabetes, and this number is expected to continue rising in the coming years. At the same time, cardiovascular diseases remains the leading cause of death globally, with millions of deaths recorded each year. What is worrying is that this rise is not happening slowly. It is happening within just a few decades. Obesity and overweight rates have also reached very high levels, involving billions of people worldwide, including children and adolescents. This shows that lifestyle diseases are no longer limited to older adults. Another important trend highlighted in the article is that lifestyle diseases are increasingly affecting low and middle income countries. In fact, most deaths related to diabetes and heart disease now occur in these countries. This shows that lifestyle diseases um, uh, are no longer only a developed country problem. Okay, to make this clearer, I will share a few short examples mentioned in the article. Firstly, India. India currently has one of the largest numbers of people living with diabetes in the world. Study shows that rates are especially high in urban areas, showing that how quickly lifestyle diseases can increase when living patterns change. Next, Chile. Chile experienced a sharp rise in obesity and diet-related diseases over a relatively short period. This made lifestyle diseases a national public health concern and placed a strong pressure on their healthcare system. Another example comes from European and North American countries, such as Sweden, Denmark, and Canada. These countries also face high rates of lifestyle-related including heart disease, obesity, and stress-related illnesses, especially among working adults. This shows that even countries with advanced healthcare systems are not spared from this trend. Okay, overall, the key message from the current data is that lifestyle diseases are rising everywhere, all age groups, and becoming a major global health burden. This trend clearly shows why today's discussion are important, as lifestyle diseases are shaping the future of public health worldwide. Thank you.
Thank you, Farahin, for the explanation. That was explained really well. So you highlighted that lifestyle diseases are becoming more common across different age groups, particularly in urban setting. And your case study clearly shows how modern habits contribute to this trend. That's excellent. So now let's move on to our next panelist, panelist two. I would like to invite panelist two, Hanim Khadija binti Hairul Nizam, to discuss the contributing factors to lifestyle diseases.
Okay, thank you, Tiara. So, before I start to explain about the modifiable factor, do you guys know what a modifiable factor means? Okay, so modifiable factor are controllable lifestyle choices, behavior, or environmental exposure that increase the risk of developing a disease. According to Jafari et al. 2024, there's a bunch of modifiable factors that may be lead to a lifestyle disease, but they had highlighted a few that had been a major contributor. First and foremost, one of the modifiable factors that can lead to a lifestyle disease is an unhealthy diet. Unhealthy diets mean eating too much salt, too much sugar, processed food, and unhealthy fat. It also means not eating enough whole grain, fruits, or vegetables. This kind of diet, where the diet that did not follow the pyramid food guide that was recommended by the Ministry of Health, could link to a bunch of risk factors that may lead to a lifestyle disease. For instance, hypertension, diabetes, and obesity. People with this problem are at a high risk getting lifestyle disease, with a high risk of developing cardiovascular disease. Next, I will talk about the other major contributor factor, which is a physical inactivity. Yes, it may seem trivial on how physical inactivity can cause harm on us, but according to Jafari et al., an epidemiological investigation have shown that physical inactivity is associated with approximately half the incidence of lifestyle disease in the world. The study have shown that physical inactivity have contributed 7.2% of all cause death globally. So, what happens when we spend most of our time sitting around, lying down, and don't move our body every single day? Eventually, our heart will become weaker. This is because our heart is a muscle that need to be challenged through physical activity to keep on being efficient. Lack of physical activity will lead to poor circulation and plaque build-up that eventually lead to heart failure. The last modifiable factor that I will talk about is stress. How surprising, right? How stress can lead to an increase of lifestyle disease. So, according to Jafari et al., his study has stated that people that are facing long-term stress will undergo autonomic dysregulation, where their sympathetic activity will increase, meanwhile their parasympathetic activity will decrease. These sudden changes can lead to a bunch of negative clinical manifestation. For instance, it can mess up the cardiovascular system. We all know about the fight or flight response, right? Now imagine people with chronic stress need to face with this response every single time, where their heart rate and blood pressure increase every single time. This will eventually lead to a weakened heart and heart failure. Of course, stress is something that need to be in our life, but we also need to learn on how to manage them so that it will not cause harm to our health. That's all from me. Thank you.
Thank you, Hanim. That is a really good explanation. So you explained the behaviors such as unhealthy eating, lack of physical activity, and stress play a major role in the development of lifestyle diseases. So let's move on to panelist three. So Jasmine, can you discuss the impact and challenges associated with lifestyle diseases?
Thank you, Tiara. Assalamualaikum and good evening to Madam Naziha and all of panelists. So as panelist 3, I will share to you guys about the challenges regarding preventing lifestyle diseases. GARC 2025, the review has identified 7 major challenges in preventing lifestyle diseases. But today, I will only highlight 2 major challenges, which is the first one is limited access towards nutritious food. This major challenges is faced by many communities where limited access to food, especially food like vegetables and also fruits. In areas with particularly low income or rural communities, healthy food options are hard to find or too expensive. I give you a study case in Malaysia where 25% adults are insufficient in food quantity according to Malaysian Adult Nutrition Survey, and 2.8 billion people worldwide cannot afford the least expensive food required for a healthy diet. This situation caused residents to rely heavily on processed food because these are the only options that are readily available. And these situations will lead to poor dietary habits where people will consume high amount of sugar, fat, and also salt. Over the time, this can increase the risk of lifestyle diseases such as obesity, cardiovascular diseases, and also diabetes. Additionally, lack of nearby grocery stores or fresh markets cause people to travel long distance, and it's not possible for people that are elderly or that have no transportation. As a result, nutrition inequality become a serious issue where a person's health is largely influenced by where they live, but not by their choice itself. And the next significant challenges is lack of infrastructure for physical activity. This significant challenge in many neighborhoods where limited recreational facilities such as parks or sports courts are limited. For example, in public low-cost housing flats in Malaysia, they lack in green spaces, parks where 43.2% elderly are classified as physically inactive because of not getting sufficient movement. This public space that is crucial for the people is poorly maintained by the local authority. Hence, residents have fewer opportunities to do exercise regularly, especially children and working adults. And over the time, these challenges will contribute to physical inactivity and declining overall health. As a result, this not only affect the well-being of the person, but also reduces opportunities for social interaction and also community bonding. That's all from me.
Thank you, Jasmine. So from your explanation, we can conclude that lifestyle diseases not only affect individual health, but also strongly influenced by inadequate access to infrastructure and limited availability of nutritious food. So let's move on. I would now like to invite panelists four to share solution and preventive strategies.
Thank you, Tara. Good evening to Ms. Naziha and all to my fellow panelists. In supporting SDG 3, good health and well-being, solutions to lifestyle diseases must focus strongly on prevention rather than treatment. According to Tabish 2017, most lifestyle diseases such as cardiovascular diseases, diabetes, and also obesity are largely preventable because they are driven by modifiable behaviors. One key strategy in health education is healthcare education and awareness, educating individuals from a young age about balanced nutrition, physical activity, and the risk of smoking and excessive alcohol intake can significantly reduce the risk. So this directly supports SDG 3 by promoting healthier lifestyles and preventing premature mortality. Another important solution is encouraging regular physical activity. Simple actions such as daily walking, active commuting, and community exercise programs can also help to reduce body weight or to control it, improve cardiovascular health, and also to reduce stress. In addition, community-based screening and early detection programs play a crucial role. As the idiom says, prevention is better than cure. Early identification of conditions like hypertension and also or high blood sugar also allows early intervention before complications started to develop. Lastly, strengthening primary healthcare system ensure that preventive services are accessible and affordable, especially for vulnerable population. Together, these strategies shift healthcare from a curative approach to a preventive and promotive model, which is a core objective of SDG 3. That's all from me.
Thank you for your sharing. So you emphasize that early lifestyle modification, health education, and community-based intervention are effective strategies for reducing lifestyle diseases. So before we conclude, I would like to ask one question to each panelist, just a brief question. So panelist 1, based on current trends, which population group do you think should be prioritized for prevention efforts and why?
Okay. Based on current trends, I think children and young adults should be prioritized for prevention efforts because recent data show that lifestyle diseases like obesity and type 2 diabetes are appearing at younger ages than before, and this trend is increasing worldwide. When these conditions start early, they usually continue into adulthood and increase long-term health risk. At the same time, young people make up a large and growing part of the population, so any early prevention efforts can have a much bigger impact over time. Focusing on this group help reduce future disease burden and pressure on healthcare systems. So based on what we are seeing now, prioritizing children and young adults makes sense from both the health and long-term impact perspective. That's all.
That's great. Thank you for your perspective. So panelist 2, among the contributing factor discussed, which do you believe is the most difficult to change at a societal level?
Okay, that was a wonderful question. So, among the contributing factor that I listed, the one that I think was the hardest to change in societal level is stress. This is because stress is something that need our own effort. What I mean is, every single person have different ability and capability in adapting to stress. So, even though with the help of motivation of other people, it is still undeniable that we are the only one who can change the way we control it. That's all from me. Thank you.
Thank you, Hanim. Okay, it seems like times are running out, so I'll go straight to final conclusion. So to conclude, our discussion today has made one thing certain: while lifestyle diseases are growing byproduct of modern urban life, they are not inevitable. We have explored how unhealthy habits and stress are often symptoms of systemic challenge, such as poor infrastructure and limited access to nutritious food. However, we also have the solution. By shifting our focus toward early education, community-based intervention, and proactive lifestyle changes, we can alleviate the burden on our healthcare system and our economy. So the path forward requires a collective effort to make the healthy choice the easy choice. So let's take the insight beyond this room and turn them into meaningful actions. And I would also like to express a very heartfelt thank you to our panelists for sharing your valuable insight and knowledge. And thank you to Madam Naziha for being our audience and staying with us throughout the discussion. So that is all from us. Thank you.
Okay, thank you, Group 3, for the panel discussion. That marks the end of our session today. So after this, please get one representative